Hi, my name's Lara Edbrooke and I'm a physiotherapist and PhD candidate from the University of Melbourne in Australia.
Thanks for your interest in this research. We made this brief video to let you know about a systematic review we undertook recently published in Respirology of outcomes used to measure physical activity levels in people with lung cancer. Physical activity is defined as any bodily movement produced by skeletal muscles that requires energy expenditure. The importance of physical activity to reduce cancer risk and recurrence is well documented in many cancer types. Additional benefits of physical activity include reduced risk of comorbidities, improvements in physical function, strength, quality of life, fatigue, and mood.
People with lung cancer have a poor prognosis and report high symptom burden. Currently, there's increased interest in physical activity interventions to improve outcomes for people with cancer. In order to measure the effectiveness of such interventions, it's important to ensure that physical activity outcomes, both performance-based and self-reported, are valid and reliable. We conducted this systematic review to firstly provide a summary of the outcomes which have been used to measure physical activity in people with lung cancer. Secondly, we aim to critically appraise the quality of those studies which reported on the measurement properties such as validity and reliability of the physical activity outcome.
Following PRISMA reporting guidelines, we searched 5 electronic databases for studies measuring physical activity in people with lung cancer. We included studies which used either performance-based measures such as physical activity monitors, including accelerometers or pedometers, or self-reported measures such as questionnaires or patient self-reported activity diaries. Accelerometers are devices worn by the patient which detect acceleration and provide information on physical activity, quantity and intensity. The search identified 21 different measures assessing physical activity from 34 included articles. Measurement properties were reported for 13 of these measures. Outcomes included 7 accelerometers, 2 pedometers, whole body indirect calorimetry, 6 questionnaires and 4 methods of patient report. Approximately half of the studies measured physical activity using performance-based measures or self-report measures, with only 2 studies using both methods of measurement. There was wide variation regarding the timing of measurement, pre, during or post-treatment, study setting, outpatient, inpatient or laboratory settings, and lung cancer stage of disease.
The wrist actigraph was the most common accelerometer used in performance-based physical activity measurement, and the Godden Leisure Time Exercise Questionnaire was the most frequently used self-reported measure. This questionnaire asked patients to recall duration and intensity of physical activity performed over the past 7 days. Most commonly, quality ratings were low due to authors not adequately reporting the properties of the comparator outcome instruments. Validity was reported for the Actigraph, Actipal, SenseWare, Kinetomap and LifeCoder accelerometers, and for the Omron pedometer. Actipal, SenseWare and Omron devices also demonstrated responsiveness. Although the Godden Leisure Time Exercise Questionnaire was commonly used, only 2 studies reported on the measurement properties. Providing recommendations regarding which measures are most appropriate to use to measure physical activity levels is difficult due to the significant study heterogeneity found in the studies included in this review. Future studies of physical activity levels in people with lung cancer should include assessment of the measurement properties of the outcome being used. Currently, we would recommend, where feasible, using both performance-based and patient-reported measurements of physical activity. Thank you.